Here in the Piedmont Triad, we're all connected by the ideas, innovations, and people working to improve our region. From transportation and planning to housing and economic vitality, we bring those conversations to you. Welcome to the Triad Regional Connections Podcast, hosted by Audra Adams and Lamar Powell, brought to you by the Piedmont Triad Regional Council.
Hi, and welcome to this episode of the Triad Regional Connection Podcast, brought to you by the Piedmont Triad Regional Council. My name's Lamar Powell, and this is my amazing co-host, Audra Adams.
Thank you so much, Lamar, and thank you guys for being here. Today on the podcast, we are continuing some amazing conversations, and we have two guests at our table today. Please welcome Bob Cleveland. He is from Ptrc, and you are the Aging Program Planner at
That is correct.
Ptrc. And then to my right, we have Dr. Althea Taylor-Jones, and it's an honor to have you here.
Great to be with you.
We've already been discussing a few things behind the scenes,
Yes.
and impressed. Let's leave it at that. You'll be impressed very soon, but I have been. So let's get into it, Lamar.
Yeah, Bob, well, so what are we talking about today? What's the subject?
Absolutely. We're talking about advocacy, and specifically advocacy for older adults.
All right, so what is that? Define that. Yep, we have that question. So
Yeah, what is it? Well, it's really about speaking up on behalf of someone else. So when you're advocating for someone, you're bringing their positions, their wants, their needs to someone else, the difference makers.
okay, very good. And so why is that important?
Well, specifically for older adults, the issue is that they often feel they have less voice than others, or I'm going to talk about somebody else's needs rather than my own. We see that happen a lot. But they also feel like, I can't talk to a legislator. There's somebody really important, and I don't even dare bother them. They've got too much on their plate. So we actually do advocating on their behalf.
We are, just to be very clear, we're talking about aging.
Correct.
And all things encompassing aging. And the advocacy is what we're going to get into. Now, we know how you're explaining the advocacy works. But tell me, first of all, when did you begin this journey of advocacy? When did that come into your life and say, hey, this is for me?
Sure. Many years ago, actually. I was working at a nursing home. I worked there for 7 years. Worked in the activities department, then became the social service director, and did that until I was spending probably half of my time just documenting rather than working with the people. So I left there and went to an area agency on aging. And there are 600 area agencies all across the country. But the really interesting thing about an area agency, it is the only entity within the entire federal government laws that has a directive to advocate for the people they serve. The only one. So you think about Social Security, you think about the people at the Medicaid offices, they don't have a charge to advocate for their clients. Not saying they don't, but they don't have a charge that the Aging Network does.
Wow.
So that's how I first really got introduced to that, and it's really my passion. So one of the things that I do, in addition to the planning work that I do, I am the lead advocate, in a sense, for our office. We write advocacy alerts, work with our senior Tarheel legislators to advocate for, again, older adults.
And so that's where, Dr. Althea, you kind of come in this capacity.
Yes.
Okay, so tell me a little bit about, number one, yourself, and then we'll get into how that integrates over with what Bob is doing.
Okay, my advocacy actually started when I was much younger. Lived with both sets of grandparents, basically was advocating on their behalf without even knowing that I was advocating on their behalf, and other seniors as well. However, the first in North Carolina, back in the 90s, I started working with the gerontology program. I actually started that program on the campus at Winston-Salem State University.
Really?
I directed that program up until I retired in 2009, looking at the senior issues, what the needs are are for our senior population. And by the way, I call them seasoned citizens. I look at all the spices that are there throughout the years in life and actually put that, coin that phrase with the North Carolina Senior Tarheel Legislator. Oh, back when I started with them in 2006. So starting in 2006 as an alternate for Forsyth County, and then changing in 2010 to become the delegate for Forsyth County, working with Nancy Hall, who right now is a retired person out at Arbor Acres, doing great. They're taking really good care of her. But we work closely together on behalf of the senior TARs. So just to tell you a little bit about the senior TARs, we started in 1993. Beverly Perdue was the senator at the time that started the organization, looking back at what the needs of seniors were, and they were not being met. So she decided that, okay, this is a time to fashion an organization based on the General Assembly so that we can have ordinary citizens out here on behalf of the seniors in our state. And all 100 counties are basically represented with 2 representatives. An alternate and a delegate from each county. Every county is not represented currently. However, we're working to get that back on track.
Well, I thought this is an amazing organization. Is this something we see in other states, or is this just unique to us?
There are organizations in other states. To be honest with you, I'm a little prejudiced, and I think that we're one of the greatest ones in the country.
Absolutely.
In terms of what we do on behalf of our seasoned citizens. But there are other aging organizations that are advocating on behalf of the senior citizens as well throughout the states.
Well, this is,
there's, if I may,
Go
there's
ahead.
something called the Silver-Haired Congress.
Silver-Haired Congress.
And that's in several other states. But not every state has one.
Right.
Yeah.
What is a silver-haired
Similar?
It's
Similar.
very similar.
Oh, okay.
They have
On behalf
people
of
that are
older
appointed.
adults.
Well, I know I was speaking with Miss Adrian this morning from Ptrc, and she kept saying the senior Tar Heels, senior Tar Heels. And so I had to look that up, do a little more research, and I found the logo and saw some information about that. So
Yes.
I think that is incredible. Then you have representation from all across the state to be able to advocate on behalf of our seasoned citizens.
Right,
Yeah.
right. And as Bob was saying earlier, there are a lot of older adults who are just afraid. They feel that they do not have the skills, or they feel that they're not capable of rubbing shoulders with. It's like politicians put on their pants the same way I
Yes.
do,
That's right.
So that's, the way I look at advocacy in terms of speaking on behalf of someone who's afraid to do so.
So how do you, as your organization, how do you organize the delegates to have the same goal in mind? Like, where do you meet? How does that work? And are you involved in any of that, Bob?
I'm always involved.
Yes, yes.
I go to all the senior Tar Heel meetings, again, as the lead advocate for our agency.
Okay.
I help collect, I don't collect them, but work with our senior TARs from across the region. We get information out to them. We write advocacy alerts that we put out anytime there's pending federal or state legislation that talks about or would affect older adults. And then again, we work with our senior TARs. So we go to the meetings. I'm there as a support to them, helping with some of their needs that the senior TARs may have around gathering of information, data, et cetera. But they themselves, they in a sense govern themselves, and I'll let Althea talk a little more about that.
We have what we coin as a legislative agenda.
Okay.
Those are our goals. Those are our objectives that we put forth. We put forth those basically in a 2-year cycle, and we're in the middle of the cycle now, the 25, 26, and coming up on a new cycle coming up in 27. We're working on those goals right now for 27. But we're looking at basically what are the issues with our seniors in the community, such as senior centers, looking at adult protective services. Do we have enough people that are out there that are actually working on behalf of the older adults to prevent elder abuse, elder exploitation, all the things that are going on there. Also, we're looking at housing, senior housing. Affordable housing is one of the main things that we're looking at now. Where can they actually live as independent as possible, while they're aging in those latter years that we call the golden years?
Yeah.
And we're also looking at community services through the Home and Care and Community Block Grant, where there are funds coming through for services in the community where they can actually go and exercise, they can socialize, because socialization, basically, or the lack thereof, is the number one killer. So in looking at that as, well, if you're sitting home and you're so isolated and you're so lonely, then many seniors give up and decide that it's not for me. I don't have any family. I don't have any friends. So therefore, I just don't need to exist. And unfortunately, the suicide rate is also rising among seniors as well. So looking at that, and then we're looking at what we call community supports, where there are other types of things in the community where they can actually get engaged with. A lot of our seniors are actually doing community service, where they're out there and they're going to the different organizations and agencies and they're delivering Meals on Wheels. They're doing other types of things with older adults, the ones that are capable of doing that. I was working with the AARP chapter in Winston-Salem, and one of the oldest members of our chapter, she just turned 86, and she delivers Meals on Wheels every day in Forsyth County to other seniors. So those are the types of things we want to be as independent, to have the quality of life that is very positive in those latter years.
Now, you've spent almost a lifetime involved in this.
Yes.
So the Senior Tarheels started in 1993.
Mm-hmm.
Is that what you said?
Mm-hmm.
So prior to that, how were things?
Oh boy, prior to that, things were awful. I mean, I'm just being honest about it. They did not have the supports that they needed, and I'm not talking about necessarily finances, but they didn't have the social supports that they needed. However, if I go back and if I'm honest with myself in terms of how I was reared, my background growing up in the western part of Tennessee, living on a farm where family was always there and extended family was always there. And of course, at that time, extended family was your neighbor, the neighbor down the road or the neighbor across the field, so to speak. So we took care of each other. Well, unfortunately, with a lot of the geographical distances and where you have to go and get a job. Say, for instance, if my child was offered a job, in fact, one of my children, the youngest one, she's worked with special needs children, and she was offered a job in Germany. And I'm going, whoa. But she said to the person that offered the job, I will never take my kids away from my parents, and I will not leave them either. So when we talk about economically, when people have to take jobs, so they have to go somewhere else to start their career, it might leave mom and dad alone, or mom or dad or whomever or both, and they have to depend on others for their caregiving to get that support. So unfortunately, the extended family is not the way it used to be. So you have to look for different agencies and organizations to, in many cases, hire people to provide that care for your loved ones.
And it's not going to be on the same level at all.
No, it will not.
So when this has come into existence, that had to be a lot of work.
Yes.
To see some major changes taking place.
Right. And that's why we have the legislative agenda, so that we're looking at what the needs are of the older adults in the community or across the state, and attempting to meet those needs as much as possible, to connect with organizations and agencies such that they're providing them. Yes.
Now, are these politicians listening? I'm sorry.
Some are and some aren't, and that's basically the frustration.
And why
at
not?
times.
Why aren't they not listening?
In many cases, politicians will not listen until their mom needs help or their dad needs help. And unfortunately, that's not their emphasis. They're thinking of other things that are more important to them until the day that they really need to get some help for that. So,
if I may, I want to jump in with
a
quick story that will maybe help illustrate what you're talking about. So I know Althea's heard this story a few times, but this happened in Greensboro. A woman had 4 chronic conditions. She had a heart issue, diabetes, COPD, maybe arthritis, but in 1 year's time, she made over 130 trips to the ER. This happened at Cone Health. After a year, the doctors are, going through the file, looking what's going on. So, holy smokes, what's going on with this woman? So they sent a nurse case manager out to the home to find out what was happening with her. The woman gets to the home. She finds out she has no electricity. Even if she had electricity, she did not have a working refrigerator So what couldn't she keep cold?
Her insulin.
Exactly, her insulin. So the doctors, out of their own pockets, paid for her electricity to be turned back on, to stock her fridge, actually buy her a new fridge, stock with food, and they sent that nurse case manager to do a little bit of education with her. So in that year since they did those interventions, take a guess at how many ER visits she had.
None.
You're right. None. She had no visits, which tells us this was not a medical need. It was a social need. That's what caused the medical, actually.
That then raises the medical expenses for the state to say, oh, okay, because I'm sure that's a Medicare or Medicaid kind of thing.
Right.
And so those resources are being eaten away when it is a different matter altogether that can be fixed a lot more economically, I am sure.
Exactly.
Yeah, the cost difference between those two.
Yeah.
So the cost for the doctors out of pocket was probably around $5,000, catching up the utility bill, buying a brand new fridge, food, etc. And then the cost of 130 ER visits is like over a couple $100,000.
Yes.
That, again, if she had the money, she would have been paying for her utilities and stuff. So she almost guaranteed she was on Medicaid. And that was now costing all of us in our taxes higher amounts of money when it doesn't need to happen. So where I'm going with the story, though, is I was telling this story to a legislator, and he kind of sat back after I told the story. He kind of had this big old smile on his face. And I said, why are you smiling? And he said, because my wife works for Wake Forest Baptist Health, and she's a nurse case manager there. She says she tells me all the time about not 130, but 30, 40, 50 ER visits in a year. And I'm like, why aren't you doing something about it?
Yeah.
And the point is that legislators are the ones that, in a lot of cases, have to make the things happen. So you mentioned before about education. There is a lot of education that has to happen with legislators, because we actually met with Phil Berger a while back, and we were talking about this. We told the story. We were talking about the data from the state that shows that how much goes into aging services and how much goes into Medicaid nursing homes. And it's a huge difference.
Oh, my goodness, I'm sure.
For people that probably, in most cases, don't need to be there, or they could have stayed at home much longer if they had those community supports. And he said, yes, I know that the state is going from 9th in older adult population to 7th. So he knew a lot about aging. But what he said was, the key is what we need to do is we need to build more assisted living so we can move the people out of the nursing home into assisted living. And I'm like, no, no, that's not the answer, because number one, then that puts all the funding on the county, which is called special assistance, to help pay for that. And the assisted livings right now are half full. So again, they don't have the staff. So again, part of the advocacy is really about education and making sure that legislators understand the issues and not just going off what they think is the right answer.
That's another reason, too, that we're pushing one of our legislative agenda items, hiring more long-term care ombudsmen, so that they can actually monitor the different facilities and they can determine what the needs are of a lot of our seniors and hopefully get to the individuals, or at least make it known so we can get more community involvement.
Yeah, that's part of what I was going to ask. So we get to the legislators, and then they pass legislations, but how does that trickle down and funnel down to the actual person who needs it? How do we get it there if they don't go to a senior center? If they don't know, how do we get the word out?
Well, I think it's really, word of mouth is one of the best ways, truly. Neighbors helping neighbors, people. I go into the grocery store and I carry my cards with me. And I might hear a conversation. And I'll say,
so do I.
Call me at the office. I can help you get connected to resources. There are information sources pretty much in every community. All senior centers are required to provide information and referral, but there are also funded agencies that provide information and referral. So actually in the Piedmont, we have both Senior Resources of Guilford and we have Senior Services in Winston-Salem that are funded to be a call center, in a sense of when you need help, I don't know who to call, you can call them and get that support and direction.
Walk me through, what are some of the support things that they offer? If if someone were to call the senior line and say, is that a transportation thing that they can do? Is that...
They do transportation, they do food, they do social connections, they do all kinds of things. In terms of helping with providing personal care. They cover the spectrum, basically.
Really?
Yes.
So the
yes.
mechanism really is the Home and Community Care Block Grant, and it's a state-funded program that has over actually 20 different services, and each county gets a bucket of money, and with that, they can decide which of those 20 do we want to offer. And that's a whole nother podcast we can talk about.
Yes,
Yeah,
yes.
for sure.
But again, one of the things we advocate for is for increased funding for the Older Americans Act and for,
Right.
at the federal level,
Right.
but the state level increases to the Home and Community Care Block Grant, because many of our services have waiting lists right now. And the two biggest ones are in-home aid and home delivered meals, which are the two prime
Yes.
services pretty much in every county that receive the most funding, because it covers that need for food and then need for that in-home help. And I was up in Rockingham County. We were talking to the county commissioners, and they said that for their level 3 in-home care, that 91% of their people on the waiting list passed away
Yes,
before they ever
before they had
got a
care.
day of care.
Okay, now I'm mad. See, this is what happens.
Yeah, I know.
Now I get mad.
Yeah, it's and matter of fact, I
It's
had
a
one of the
sad
county
statistic.
commissioners come
Yeah.
down after the presentation.
Yeah.
He's like, "Was that true?" I'm like, "Yes, it's absolutely." And I was standing next to the provider, and she said, "Yes."
Not
So we
only-
need to do a better job.
Yes, much,
Yes. Well, again, there needs to be more funds. And it's not just about, everybody wants more funds, right?
Right.
But as we talked earlier, it's about the economics of it.
Well,
It's
and-
like it costs you, it costs you maybe, $7 to provide a meal, and probably about $2,000 a year to feed someone 5 days a week, a hot meal. You've got someone who puts eyes on the person. And again, versus a couple $100,000 for hospital visits or much, much more expensive care in a long-term care facility. But when you don't have those services, that's the only option that's left.
I delivered Meals on Wheels for a few years when I first retired, and looking at some of the conditions that older
Yeah.
adults are in, and many of them, they get one meal and they make 3 out of the one.
Yeah.
So when you're thinking about, they're not getting what they need, their basic needs are not being met. Also, some of the other things they do too, in terms of the social connection and social support, they provide dog food for the pets or
Good,
pet food,
yeah.
'Cause
whatever.
that's
Yes,
something that
because that's the
emotionally,
companion in a
yeah.
lot of cases for the older adults. I've gone into homes, and the first thing I meet is the dog at the door, and they're waiting on the food for the dog as well, and other types of care for their animals, their comfort animals that they have as well.
So, how does this become a more emergent matter? How do we?
It's a matter of informing people, educating or informing people about the reality of life, what's going on. Eyeball people, go beyond just your home, your community, your neighborhood, but get out and go and visit and offer some volunteer time, just some observation to see what's going on in the world. So many people have no clue whatsoever, but have the skills and the opportunity and the means, the resources to actually contribute.
Yeah, and I would say too that I'm working with Rockingham County because I'm a planner to that county for aging, and they have candidates for office because the two incumbents actually lost their reelection bids. So the committee is actually organizing where they're going to bring in each of the candidates, one for both Democrat and Republican for the Senate seat and also for the House seat in North Carolina. And so they're going to come up with questions. Actually, I'm meeting with them tomorrow, and develop questions we'll send to the legislature and say, we want you to answer these questions, because they want to get in front of those people before they get to Raleigh and be able to talk to them about, here's what some of the issues are. Here's what you need to understand. Here's what you need to know. And so we hope that we can count on you to support older adults, because our population in the state, you probably already know this, but it's rapidly growing in the older adult population. Again, we're moving from 9th in the country to 7th in terms of older adult population. It's a great destination to come here to North Carolina. So our numbers are exploding. And the problem is that we do have people who need those supports and they're not getting them.
The 60-plussers are outnumbering the 17 and younger now in our state.
Yeah.
So
Wow.
they're in migrating, to the state, great state.
Do y'all come up with the type of programs and do cost analysis so that you put that in front of a legislator? Is that something that?
We have those tools. So like
Right.
for every county, when agencies receive the funding, they have to enter into statewide database to say, here's our service, what we provided. The rates are set at the beginning of the year. So if a meal costs $7, that's what it is for the entire year. But we do share that with legislators. We have demographic data that we show. The report I think I mentioned earlier, where the state county expenditure comes out, and we draw those parallels for them to see that, look, we're spending a lot more over here when maybe we could be spending a lot less over here and serve more people.
When you ask the question, how do you get it out to the people?
Yeah.
You appear before the Board of Commissioners like I do. You ask for a spot, and you go and you give your reports to them. You let them know what's going on in their county. For Forsyth County Board of Commissioners, go to their meetings, give them reports each time the senior Tarheels meet. I'll let them know what happened at the meeting and what's the next move for that. Not only that, but also in terms of advocacy, working with the participants at the senior centers and so forth to get them to understand how to connect with their elected officials, not to be afraid to do so. The last county commissioner meeting I went to, I had no idea that there were 25 people standing on their feet behind me while I was talking.
Really?
So when you get people to actually put the action with it, then that says something to the county commissioners. And then from that point, listening to the chairman, Dr. Martin, he immediately said to me, okay, I see what you're saying.
I guess I want to kind of go here a little bit, and it's not off topic, but if you go in and you say, okay, Medicaid, Medicare is spending this. If we allocated some resources over here, then this spending would go down. What incentivizes them, or what proof do they have? It would seem to me that if you started pulling resources from the Medicare, and people be real mad about that, and to make those parallels, it's just mind-boggling to me. How do you get them to believe enough to change the budget, or to change the grants, or to change, like, that's...
Yeah, I can give you that answer, because there's somewhat of a divide between what we call the social drivers of health, and that's, again, like food, education, transportation, housing, those sorts of things, versus the medical side of things. And in our country, the medical side drives a lot of it.
Right.
It's a big, huge business.
It is.
But several years ago, Medicare, there's traditional Medicare, and then there's Medicare Advantage. And Medicare Advantage is privatized Medicare. You have to get everything you get in Medicare, but these plans can offer a little bit more. Well, it was, I don't know, back in the late not 90s, pardon me. It was in the late, like 2018, 2017, when these plans could start offering more than what Medicare does, in a sense of they might get a card. And actually, my mother-in-law in Florida, she gets $140 a month on a card from United Healthcare that she can use for gas in her car, food, paying her rent, because they understand that paying for those things is going to keep someone healthier, and they will have to pay out less. United Healthcare, the company, we've had their one of their bigwigs, in a sense, I don't know his title, is Kevin Moore from Minnesota, came to Ptrc several years ago, and he was talking to everybody. He said, we have invested millions of dollars building housing in, at that time, it was like 14 states. Just a couple of years ago, they built the first one in Matthews, North Carolina. They're building housing. You're like, wait a second. They're a health insurance company. Why are they building housing? Because they said, what good is it if we bring a homeless person in? Right. And we bring them in the hospital, they get food, they get a TV, they get a warm bed, and then what happens in a few days, we kick them right back out on the street. And then they get sick again. They come back again and again and again and again. And so the thought of that company is like, it costs us less, which is mind-blowing, to build housing and get somebody off the street and keep them well, than it is to continue to pay for those high-cost healthcare. So that's the data, and that's what these plans are now starting to do. Humana, Blue Cross, United Healthcare, all these plans are paying for some of these additional benefits. But alongside that, North Carolina was the first state to allow Medicaid, and this had to be proven at the federal level, to pay for social drivers of health. They did this experiment. Unfortunately, it happened right at the start of COVID, so it
Yeah.
messed up everything. In 1 year's time, they had it rolled out, and they were providing services and supports to help people with Medicaid, with some of these extra things. It was in 4 categories: food, housing, transportation, and interpersonal violence interventions. In 1 year's time, they proved that they saved $85 per member per month, 10,000 members. That equated to $20 million saved in 1 year. So we're not talking small potatoes here.
No, that's
No.
what I.
And so when you ask for the
yeah.
proof, that's the proof.
Yeah,
That's the data
it's there.
that we try to use with our legislators to show them, look, we need to work smarter, not harder. And the smarter thing is to invest the dollars in social supports. And we're the only country in the world that does it backward.
Oh, yeah.
Truly. Every other country in the
Yes,
world
yes.
spends more on the social drivers than they do on the medical. Now,
Mm-hmm.
I don't know if they have always done it that way or if they learned that that's the best
Yeah.
way. So, but the problem here is that we have had the big business of healthcare,
Mm-hmm.
and it's going to be hard to transform that system. It started to change.
Well,
but-
if you're emotionally stable, then your high blood pressure goes down, so to speak. You're making better choices and don't have the diabetes and what have you. So when you think about that, the cost of the medical treatments or the things that they're needing, if they're controlling that on the other end, you never get to that point where you have to spend all that extra money
Yeah.
to do that.
So what I look at thinking about, if I'm an elected official, whether it's on county, state level, we have this tool available to us. It seems like to me you would want to listen. You have this tool of people of that age group who are advocating for that age group. You have all the stats and things of that nature. What a tool to be able to have, and you need to be listening to that. So what are the biggest problems that you're facing now or that you want to see change out there to make it better?
So many elected officials are going in just for the notoriety, just for the personal involvement. You put the camera on me, you put the light on me, and this is who I am and what I stand for, as opposed to going in with those goals in mind that these are things that I really need to take with me and start working toward. Particularly when we talk about appropriations, those that are in charge of the funding, the monies that can go toward senior programming and so forth. Well, they might choose another group of individuals, and I'm not downing children or middle-aged people or what have you, but many of them really, they don't have the knowledge, they don't have the information as to what the needs are, so therefore they're going in with their own agenda as opposed to looking at what they need to put the energy
So if you
toward.
could say right now, between the two of you, one each, what do you need right now that you don't have in your organizations? What is the first thing that comes to mind? What do you need to make this better?
To make this better and for the older adults?
Just in your organization, like what is the roadblock
As
that
far
you're coming
as
up?
for the senior TARs, totally looking at that. We're looking basically at people to understand that the community supports that's what we need.
Okay.
That's exactly what we need, so that people have a place to go, people to connect with, and activities to engage in, such that it's making their lives more positive. And in the connection or in the collaborative approach with that, you get your food, you'll get your transportation, you'll get whatever else you need, the housing and so forth and so on. It's just a matter of assessing those needs, looking at what they are, how they're living, how in comparison to how you're living, maybe.
Okay.
It's almost to the point of giving back and paying it forward.
Gotcha. And what about you, Bob?
A lot of the same thing. I mean, again, a lot of it boils down to funding, right? We need the funds to support more meals, more rides, more in-home care, et cetera. There do need to be a lot of changes in the aging network. And again, one of the things is workforce. There's been a decline in the number of CNAs available.
Oh, yeah.
And certainly there's also decline. We also talked about the family members, right? So there's not as many caregivers as there used to be, which means we need more caregivers to care for the people. And we don't have that. We used to have a lot of young women going into that field. They're not doing that at the rate they used to. They're doing other things. They're doing podcasts, and they're doing not to say this, but they're on TikTok, and they're on
Social
influencers.
media.
Let me say that. So they're finding other ways to make money, and not something I don't have to break my back of lifting someone in and out of bed. And
my daughter is a CNA, and I mean, she's only 21, and a lot of already back problems,
Definitely.
yeah, it's hard work.
leg vein issues. And I know Daniel's daughter is a CNA. It's definitely something you have to be.
So there's a need there, but how can that change?
Well, when you're looking at it, it goes back to what I said earlier. If you're providing the other types of supports, you don't need the medical attention,
Right.
Because they're healthier. They're
Gotcha.
healthier, or if they're not healthier, they're becoming healthier because of the social connections and social supports that are there to prevent the different diseases and so forth.
Gotcha.
So,
And the pay's probably not as good.
It's not.
It probably
It's
needs
not.
to be a whole lot better,
does.
because that
It
would
does.
help
right.
make that more attractive to more people.
It has increased, but the problem in that field is that typically you've had people who are working part-time because the agency will only hire part-time. That way they don't have to pay benefits.
Right.
Childcare, mileage reimbursement, all that. Some agencies do, some don't. I would say probably most don't. So there needs to be changes in that. And that's also an
A lot of them
opportunity
can't
for
afford.
advocacy.
Yeah.
But the one thing I will say too is that we had Donnie Lambeth come and talk at Ptrc, and he was talking about the state budget and all that. And one of the things he said that shocked me was that he said that right now in the Senate, they're talking about reducing the North Carolina state income tax from like 3.99% to basically nothing. Like to 1%. What he said was that for every 0.5% that you reduce the income tax, the state loses $2 billion. And I'm thinking, so they want to go from 3.99 down to 1. I said, you're talking about losing almost $10 billion in the state. Where's it going to come from? And so if you don't replace that income with something, now you're going to have to cut services. And we can't afford to cut aging services right now. We don't have enough as it is. So that's one of the things that I have talked to some other legislators. I'm like, how are you going to do this? Because right now that's predominantly in the Senate. But Donnie, who is a Republican, he said, I and some of the other Republicans are against cutting the income tax because we'll lose all this money.
Right. Well, there's a divide, and it will always be a divide. Unfortunately, the middle class and the lower class, they're the ones who's getting, the brunt of it all. Yes,
end
yes.
of the deal.
Yeah, you cut our taxes, of course, and then you cut the taxes at the top as well, and that's where we're losing with the persons that could afford to pay more taxes paying less.
Yeah.
And we advocate for things like Social Security change as well.
Yes.
Social Security is looking to reduce funds like by 20% or more.
Yep.
Coming up down the road because there's so many older adults and there's not enough funds.
Right.
They could be doing more to make changes right now. Like Social Security is only taxed on your first $100,000 and maybe $60,000. So it means everybody who is lower income is paying dollar for dollar on everything they earn. Somebody who's a millionaire is only paying tax on the first, 15%
Yes, and then nothing.
what they're earning. And again, so if you put more money into that pot, it would be available for everybody. And
It
again,
just seems
let
like
them withdraw.
so many things are common sense.
Yes, they are.
Yes.
That's the problem.
I don't understand at what time, and this is just pontificating, and then we're going to close this out. When did it just change? I mean, when this country started 250 years ago, these were not the ideals. This was not how things were supposed to be around here. And it just is like, when did this part truly
when people started making money, when money became king.
Oh boy,
that's when the problem started happening, because if you go back to when the factories were happening, right? You had the Rockefellers and all these folks. I've loved the History Channel because you get to see the men that made America, and they talk about how they had this, but they also talked about,
what were there, like 5 of them, basically?
Rockefeller and Carnegie and the financial guy. I can't think of his name, but
yeah, I know who you're talking about.
But the point was, they made a lot of money on the backs of the people that were working for them. And I'm not here to talk about all of that, but just to say that, that caused a lot of it. And that's how unions first started, because the workers were being working long hours and being taken advantage of. In a lot of ways, we did that also with the immigrant workers now. But now that we've cut that out, who's left here to tend the fields and raise the crops and do a lot of that?
Right.
So
a lot of cultural issues.
Yes.
A lot of them. So the rich gets richer and the poor gets poorer.
And we're not taking care of the folks that need to be taken care of.
Yes.
Well,
So there's an Advocacy Day, an Advocacy Month.
We
What about that?
we would go down to and I say we, the senior Tarheel legislators, we would decide to go down to the General Assembly to meet with our elected officials on a day in the month of May. May is Old Americans Month, and we would go down one day. This year, we decided to make the entire month Advocacy Month as opposed to Advocacy Day.
Okay.
We have 16 area agencies on aging across the state, and out of the 16, I think we ended up with 8 or 9 that were able to actually go down to the General Assembly. So we had 8 or 9 days out of the month as opposed to one day. And our goal, hopefully, is to get all 16 engaged with that, and even to split the different regional delegates and so forth, such that we could do 2 days as opposed to one and cover the entire month, hopefully coming up next year.
Okay.
So we're expanding our presence with the General Assembly, going down, letting them know here we are. We're really advocating on behalf of the older adults in North Carolina. And as you see more people, and that was the reason we did that, as opposed to, say, if you had 200 people there one day, we're talking about if you only have 10 or 12, but you have them there for 20 days, then the presence is there more often, not necessarily in numbers, but they're seeing that the senior TARs are there on behalf of the older adults that we're advocating for. So that was basically why that was the way it is. I'm the Advocacy Committee Chair, and that was one of the things that I asked the Speaker if we could do that. She agreed, and we went for it this year. So.
How do people get in touch with your organization? And then I want to ask the same of you, Bob.
Okay, as far as the senior Tarheel legislature, we're actually working through PTRC, through the Area Agency on Age. Bob is our go-to.
So,
yes. And with if they wanted to get in touch, they could either get through Area Agency on Aging, or they would, if they know their delegate and alternate within their county, they can do that. They could also get in touch with the senior centers and other places that are very much aware of who we are and what we do, because that's how we keep in touch.
Okay.
With the Shepherd Center here in Kernersville.
Yeah, you do have a website.
Right, we do have. I was going to get to that.
Okay.
But the Shepherd Center here in Kernersville, I work with them on a regular basis. I also serve on their board.
Okay.
So, and with the senior services, I volunteer with them in Winston-Salem. So it's a matter of the connections that we as the delegates and alternates have on the local level. And then, of course, there is the website that's listed for senior TARs, where they can go and find out all the information that they need to find out, in addition to our legislative agenda and so forth. I think I put it on, it's at the bottom.
So it's www.ncsTHL.org, and that'll be on the screen.
Yeah.
Right.
And then, Bob, you give us the way to contact, or everyone the way to contact.
It's very easy. It's www.ptrc.org. That is our website. They can always call our office at 336-904-0300. And they'll get to one of the aging specialists, and we will try to direct them into the proper place or answer questions, connect them to advocacy.
I just want to say thank you all so much for, it's tireless. It's decades. It's not, and you just woke up one day.
Yeah.
It's a lifetime
It is.
of doing that. And it's your heroes in my eyes on that. So thank you so very, very much. And please don't stop.
Quite welcome.
I definitely will take some of this. I have aging parents. I have, things that it does pertain to all of us, I think. So
sure.
I really appreciate y'all being on the podcast.
Absolutely.
You're welcome back anytime that you have something to say. You are so welcome back here.
For sure. Well, thank you for joining us today. And man, what a great topic. So we appreciate you being here. We'll see you on the next one.